Hello, fellow learners. This is your mentor, your fact check buddy, once again joining you in another teaching and learning session related to two important topics, could be related topics that you need to remember as you prepare for your test. So let's begin and let's engage. So these are the two topics that I am talking about early on. These are your FROVATRIPTAN succinate and migraine headaches. So what's the relationship of these two? So that's not going to be difficult for you to remember. You just remember the first half of the medication's generic name. So you just call it Pruva. Okay? So Pruva actually belongs to the medications that are classified as triptans. And what do? These medications would usually cause vasoconstriction of your intracranial vessels that are pain sensitive. And one of those physiological alterations that are believed to be causing migraine headaches could be the dilatation of blood vessels in the brain. Okay? So since dilatation of blood vessels in the brain leads to migraine headache, there has to be a medication that reverses that dilatation, and FROVATRIPTAN succinate is one of those drugs. Okay? So, but before we do so, once again, today's good news I'd like to share with you. This is coming from Eden May Woods. Okay, and she actually left a comment in one of our videos, Osteitis Defermans, and she says, "Thank you so much, Dr. Gapuz, for the great YouTube NCLEX review materials. I'm always excited to listen to your blog. Appreciate much, sir, for sharing this video and your expertise and knowledge in the nursing profession around the globe. God bless you and stay safe always." Thank you so much, Eden May Woods. Those very, very kind words really serves as my fuel when creating videos such as this, especially now that I'm in a bubble here at home. I'm like a premature baby, a preterm baby inside an incubator. Okay, anyway, so I'd like to invite you to join me in a mission to put 100 nurses, our colleagues. We've done this last year. We'd like to do it again to provide free NCLEX RN application and review to 100 nurses. And to help us achieve this, just watch and finish the ads in our video. So thank you. So let's begin with our functional concepts. FROVATRIPTAN succinate is used to treat acute migraine headaches in adults. Once again, if you are asked how, well, it actually causes vasoconstriction of intracranial vessels. But just like any other drugs, your FROVATRIPTAN also would cause some side effects. Okay? So here we go. Let's try to answer a sample question based on the little thing that we learned about migraine headaches and Pruva. Okay, so FROVATRIPTAN succinate can also help relieve which of the following conditions. This is what I'm afraid of. When you're preparing, you're just so focused on certain things and you forget to expound on your readings. Now, what if what we're asked were not the things that you studied? So that's going to be frustrating, especially if the topic seems to be familiar to you, but you have not gone beyond the little things. Okay? So to answer this question, we need more help from our functional concepts method, which is the approach that makes every test taker going through the Ray Gapuz way of doing it pass the test. So that's the magic recipe for NCLEX RN passers. So once again, FROVATRIPTAN succinate relieves nausea, vomiting, photophobia, or that's going to be intolerance of bright lights, phonophobia, intolerance to loud sounds, okay? But take note that FROVATRIPTAN or Prova could potentially increase the blood pressure, and it could also cause joint pains as well as gastrointestinal irritation. Now, it could also potentially lead to dizziness and drowsiness. So maybe we could actually ask those who are taking the drug not to engage in any activities requiring alertness when they are taking the drugs. So let's move on. So Prova should not be used with sumatriptan and linezolid. Sumatriptan is another drug for migraine headaches. It potentially worsens the side effects of Prova. Linezolid, on the other hand, is an antibiotic that may also worsen the side effects of Prova. So your sumatriptan and linezolid should not be taken with Prova. Okay, so do not use FROVATRIPTAN SUCCINATE for more than 3 doses in any 24-hour period because you might potentially worsen the adverse effects. So FROVATRIPTAN may cause changes in vision, chest pain, and confusion. Now that we've learned something about the drug, let's now try to answer the sample question using the knowledge we gained from functional concepts, the unique way of passing your test on your first try. So FROVATRIPTAN SUCCINATE can also help relieve which of the following conditions? Hypertension? No. I said a while back that FROVATRIPTAN may potentially increase the blood pressure. So we put an X. Migraine headache? Yes. Sensitivity to bright light? That's photophobia. Intolerance to loud sounds? That's phonophobia. Nausea? Yes. And joint pain is a side effect of the medication. So we have to put an X. So I just hope you learned from our very short video, but very meaty. So if you want some more, let's learn together. Send in your request to my email, mentor.raygapuz@gmail.com. Here's once again your mentor Ray saying a functional concept a day keeps your NCLEX RN fears away. So if you love this video, please don't forget to subscribe, share, and hit the like and bell buttons so that you'll get notified when we upload new videos, and we do so on a weekly basis. So thank you very much for those who are sending me very, very kind words through my email. I'm reading every single message that you're sending me. Thank you so much. And may your tribe increase. Okay. See you again in our next video.